Hello friends, my name is Gopal and my friend name is Yash, Parth and Aniket, and our group number is 85, and our today's topic is the understanding of IoT security risk in healthcare. So as we saw, the Internet of Things is transferring the healthcare factor, providing support of opportunities such as revenue with monitoring continuous development measurements and integrated healthcare devices. However, security threats are becoming increasingly dangerous as IoT integrated and implemented. This measurement that's managing this risk requires appropriate IoT security risk management models for protecting healthcare information systems. So, understanding IoT security risk in healthcare. So, IoT security risk in healthcare provides data eavesdropping, identifying data confidentially threats, and location privacy. So, facilitating group discussion on IoT security. When presenting a discussion questions concerning IoT security risk in healthcare, this meant that the facilitator intended to get the standard students involved. Considering adopting these techniques, first technique is guided questionings. Second is breakout groups, and third is interactive scenarios. So, my fellow friends will make the next presentation to the group. Thank you.
My full name is Aneetkumar Patel. Today I am going to discuss about IoT security risk management models. Well, several models provide primary, secondary, and tertiary risk analysis to maintain refinement and compactness and safeguard data authenticity and system efficiency. Next slide, IoT security risk management models. Well, in this slide, the information security risk assessment, which is called ISRA, this model concentrates on the threats and risks that may threaten information security, confidentiality, integrity, and accessibility. It evaluates the likelihood of external threats such as cyber threats to exploit IoT weaknesses in healthcare and then enables hospital to employ protective security strategies. The analytic hierarchy process, which is called AHP, this model enables the organization to rank IoT dangers, putting them into a pyramid factors like hardware security, data confidentiality, and patient lives. Uh, for example, Wangert 2020, AHP can be used by hospitals to decide on what risks are more important than the others, which is useful in assessing the importance of risk factors highlighted above. Next slide, IoT security risk management models. Well, in this slide, privacy security risk assessment, which is called a PSRA. PSRA is one of the relatively new models used to identify potential privacy concerns in IoT system early on. It can allow care delivery systems to prevent risks that may endanger patients' data before legal requirements like HIPAA, HIPAA are met. Bayesian network, which is called BN. BN enables the determination of the occurrence of risk together with an examination of the threat spread in IoT systems. For example, Behani 2023. In healthcare, this model can infer the effects of different risk for example, malware in medical devices, and contribute to coming up with strategies for managing the risks. Well, another my team member will discuss about uh, next slide. Thank you.
Hello, this is Parth PATEL. In this slide, I discuss about the facilitation group discussion on IoT security risk management. This study seeks to research the impact of IoT in the healthcare industry and align sector as a healthcare undergoes digitalizations due to the IoT technology revolutions. Healthcare variables, remote health monitoring system, and smart healthcare instrument assure the healthcare service supplier of the constant knowledge regarding the health condition of the patients. However, cybersecurity becomes a major challenge in the IT operation as a IoT take prominence in the healthcare sector. It is paramount that any business is in a position to recognize the control such as the risk because they affect patient safety, data privacy, and compliance with healthcare laws. This make IoT security risk management in healthcare crucial for discussion. Further, in this slide, I explain about the facilitator role in IoT security risk management, policy development, and implementation. According to this risk, the facilitator also provide assistance in the formation of policies that govern the use, handling, and protection of the IoT device in healthcare. Such a policy may comprise access control measures, encryption techniques, and the procedures of the checking device periodically. These policies have to be in compliance with the healthcare standards, including the Health Insurance Profitability and Accountability Act, and this is done by the facilitators. Second one, incident response planning. Coordinator have the duty of overseeing the development of these to be prepared in case of security incidents, including the action checklist, policies on the role and responsibility in the context of the incident communications, and management policies for that reduction of the impact together with the recovery policies. These plans are communicated to all IDs by the facilitator throughout the orientation sessions, training, and exercise. Thank you.
Hi, my name is Patel Yash Kumar. I am going to share the slide risk management and strategies. So, risk assessment and prioritizations organizations must perform evaluations of load device that would allow them to determine risks and threats. This include determining the importance of every device and the informations that pass through it and the consequence of the threat security improvement are most important when devices are used at a high risk. Access control and authorizations like the use of MFA help make it very difficult for an unauthorized person to get access to lot device and the data they process and the minimizations the possibility of instructions and laws and informations by unfit persons or organizations. So the second slide is the management strategies. So the encryptions and the data protections, it is crucial to draw specific attention to the fact that each internet of things device must employ end-to-end encryptions, and thus I would like to address this issue by so doing encryptions ensure that any other party that may internet and the data and transmission should not have any luck in reading the informations and the law and the conclusions. the conclusions, this risk calls for a practice of a research validity and world class lot security risk management models, and which include ISRA, AHP, PSRA, and BN group discussion on this risk enable the student to learn the possibility solutions such as instance access or authorizations and content monitoring by the end of the discussion using a question and real life example. The participants can how they could improve security on the lot to private threats to healthcare systems. So, and the reference, these are the reference, and thank you.